Hi everyone, thank you for joining me today for Tristan's annual IEP meeting. We will just jump right in and get started since everyone is here. My name is Lisa Gates. I am Tristan's IEP manager and special education teacher for this year. For the sake of this recording, I will go around and introduce everyone who is here today. We have Robert Johnson, Tristan's father. We have Chris Kreider. She's our principal here at Marcus Whitman and is also the district representative today. We also have Christy Ballow, who is our speech pathologist. Tristan is here in the room, but he is over off in the corner, and as he is 5, he will not be participating in today's meeting. So we will jump right in and get started. Robert, I've brought you a copy of Tristan's IEP. And then I also have the procedural safeguards. You'll remember that from the last IEP meeting. Those will be offered to you at every IEP meeting. It kind of goes over all of the laws that apply to you, all of your rights as the family of a student with special needs. So the reason we are meeting, this is the renew of Tristan's annual IEP. This happens once a year, we will be meeting again in just a few months in June for his next evaluation. So if you feel like anything needs to change after this, we can always go in and amend it after his next evaluation as well. So I'm gonna go through for our norms. I like to just go through the IEP, kind of get everything out there. Please, anyone, feel free to stop me as we go about if you have any questions. I might refer you to later in the IEP meeting or to maybe someone else here on the team that can answer your question, but we are all on the same level here. Myself, you, Robert, Dad, Principal, we're all on Tristan's team and we're all active participants. So if we can agree to those norms, we will jump right in. I'll read off a lot of this information, but like I said, feel free to stop me if you have questions. So current IEP information is that he is receiving services for cognitive, communication, and adaptive, as delays in those areas make it difficult for him to learn in a whole group or small group environment. When he's not in a one-on-one setting, he's easily distracted and disengaged from his peers and teachers. He requires that one-on-one specialized instruction with adult intervention, guidance, prompts, and modeling to be successful in gaining new skills. He also requires specialized instruction and adult assistance in order to be successful following school-wide safety rules, to be successful in both that classroom environment and just the school environment itself. So he currently qualifies based on his last evaluation that was almost 3 years ago for adaptive, cognitive, and communication. And we'll talk about the present levels of achievement now in those 3 areas. So currently, for his cognitive, he is able to identify all upper and lowercase letters when they're shown in random order, and he can correctly state the sounds for 20 out of 26 letters. He is also able to read 10 out of 92 of the Dolch pre-primer sight words. Dolch is the list of sight words that we're currently using now as a district. He is able to correctly write 36 out of 52 letters of the alphabet, assessing on both upper and lowercase. And he struggles with correct letter formation, sizing, and alignment. He is unable to copy a 4 to 6 word sentence without significant adult support. That can be verbal cues, modeling, as well as hand-over-hand support. He is able to count by ones, up to 100 4 out of 5 times correctly, but is unable to go past 100. He can consistently identify numerals 1 through 10 correctly, but he struggles with comparing numbers and age-appropriate addition. Currently, no trouble with fine motor, vision, or hearing. For language and communication, he struggles to answer basic where and what questions. So, where is the pen? To be able to say it is on the table. He is tricky. He memorized the order that we were asking the questions, and so he was giving the correct answers, but then when we switched the order of the questions, he was no longer able to tell us correctly. He was just listing in the order that we had previously been assessing him on. He also has delayed vocabulary and is unable to name many of the 50 grade level vocabulary words when shown pictures. So, for example, he wasn't able to identify a picture of a pillow. When shown a picture of a foot, he said toes, but couldn't say foot. And then was unable to name categories for things. So when shown various fruits, he was able to name banana, apple, strawberry, but couldn't tell us that those were fruits. Similar when shown animals and people, couldn't tell us the category for those. He currently does not have any eligibility for social and emotional behavior. We will assess that again at his next evaluation, which again is in June. And for adaptive, he struggles to stay engaged and focused on academic and non-academic activities that he deems undesirable. So if it's something that he wants to do, he's more likely to be engaged and follow directions. He has a difficult time following school rules, even when those rules are discussed immediately prior to the activity. For example, when we walk in the hall, we need to use our walking feet. We'd say that right at the door and then open it and he would run. So here we have the classroom-based data. That's data that I and the assistant teachers have collected. And we also have family input, so thank you, Robert. You did note that Tristan is progressing socially and academically more similar on part of his 2-year-old brother, so that would be a delay. And you mentioned you were curious if more support could be provided through diet change, a sensory diet, or perhaps medication. That is not necessarily my area of expertise, but I will provide resources for you through our school psychologist, and she can help you decide a little bit more if those things might work for you and Tristan. Summary of work habits. He struggles to maintain attention for 15-minute time rotations. That's how our class works. And he will frequently ask help for tasks that he is able to do. And will avoid doing tasks that he is unable to do. He does not seem to be motivated by positive or negative reinforcement. So moving on to the summary of academic needs, summary of educational needs and general accommodations, and the consideration of special factors. So if you'll turn the page here, consideration is not needed for a transition plan. He will stay in this classroom for 1st and 2nd grade, since this is a kindergarten through 2nd grade classroom. We don't need the statement of transfer of parental rights, not yet anyway. Statement of positive behavior intervention strategies and supports. At this time, his behavior is not what's impacting his learning or the learning of others. Language needs for limited English proficiency, not applicable. He does not need Braille, does not need assistive technology or devices, and does not need a statement of communication needs. So if you'll turn the page again, this next area goes over some assessments and how they will be provided to him with some additional accommodations. So all of his state testing will be done in the classroom, and he will be allowed to have the test questions and directions rephrased as necessary to simplify the wording to help him understand the true question, and he will be allowed to take breaks as needed. This is for all assessments that take place in the classroom. We don't currently have a list of his results for standardized testing. This school, we're piloting a new set of assessments called iReady, and our window for starting those will begin next week. So at his evaluation, we can add those in there. If you want to turn the page again, he's currently in a self-contained kindergarten through second grade classroom. And he does spend lunch, recess, and specials in a kindergarten classroom, which equals out to about 34% of his time in a general education setting. And the reason that he's in this self-contained classroom is, like we said earlier, to be successful, he really needs that individualized one-on-one support in the areas of reading, writing, math, adaptive skills, and communication. And those delays make it difficult for him to receive the necessary support if he was not in the self-contained setting. So moving on to his annual goals. We'll go through them right now. So for cognitive, that's broken down into reading, writing, and math. So for writing, his annual goal is that he will be able to correctly write 52 out of 52 letters of the alphabet, so that's all letters, both capital and lowercase, from 0 out of 5 times to 4 out of 5 times, as measured by teacher observation and writing samples by 1/28/2020. That's when we'll meet again for his next annual IEP. And he is currently able to correctly write 36 out of 52. For math, I have his goal that he will be able to count by ones to 120 correctly from 0 out of 5 times to 4 out of 5 times, as measured by teacher observation by 1/28/2020. As a reminder, he is currently able to count to 100 but struggles to get far beyond that. And for reading, Tristan will be able to read 92 out of 92 Dolch sight words as measured by teacher observation and assessment by 1/28/2020. Currently, he is able to read 10 out of 92 of the Dolch pre-primer and primer sight words. So do those goals sound okay for the cognitive? I provided you a copy with this a week ago and didn't hear back, so I assumed that those were good to go. Okay. For adaptive, Tristan will follow school rules. Those are hands to self, walking quietly with walking feet, with 3 or less prompts from 1 out of 5 times to 4 out of 5 times, as measured by teacher observation and data. Currently, he struggles to follow those school rules, even with prompts and direct discussion before the activity. As for communication, Tristan will be able to label 50 grade level vocabulary words when shown pictures to 80% accuracy by 1/28/2020. And he is currently at less than 25% accuracy when shown those vocabulary words. And again, if those sound good to you, we will move on. We talked about this a little bit, but the accommodations, so for all of his classwork and all assessments, he will have the test questions rephrased and directions rephrased. The test wording may be simplified, He will be allowed to have breaks. Individualized and small group instruction will be allowed, and directions can be modified and repeated. So family communications, how will you know how he's doing? Robert, like you know, daily I send home his folder, and that will kind of give you a daily overview of how he did. And then we will also send home progress reports 3 times a year. I do not at this time think he qualifies for extended school year. Based on how he performed when he came back from winter break, he didn't lose significant skills. He came back pretty close to where he was before we left for spring break, so that's great. Summary of services. This kind of gives you the numbers, so exactly how many minutes per day and per week of each area he will receive services for. For his reading, he'll receive 68 minutes a day in reading instruction. He will receive 70 minutes of adaptive instruction, 30 minutes of writing, 45 minutes of math, and then 15 minutes a day of communication, direct instruction. And that is all. So if you have any questions, now is a great time to ask them. All right, and lastly, I just need signatures. So if you would please sign your name and then your relationship. So I will put special ed teacher, and then today's date, which is 2/26/19. Thank you.